Is there like a time frame by which we can be like, this is not effective? Like if an agency is working with somebody and then like at what point do we go, okay, we've given this enough time and
Yeah,
you guys just suck.
I'd say a month
Okay.
because the wounds should be healing every day. And if in a month you either have no improvement or it's getting worse, or even if it's improving, but less than like 50% of, so in a month is less than 50% smaller, then something's wrong.
Gotcha.
Then you need to maybe look for another provider.
Okay. So, do you have any advice or tips on how agencies can document or kind of like any tips for ADRs or anything like that?
Yeah, I think a big one is the documentation in terms of measurements of the wounds. They should be, measurements should always be a part of the documentation and along with the photos. But the big thing about the measurements, they should all coincide with the measurements that are in the documents, in the notes, physician's notes or wound group notes, because even if these wound groups send a person who's not very trained, they do get trained on how to measure the wounds and how to look at them. And in order to properly measure it, you have to correctly expose it, correctly not stretch it, but remove all the obstructions and position the tissues in such a way that the wound is exposed properly. That's just surface measurements, but sometimes if you want to measure the undermining under the edge of the wound or the depth of the wound, it also has to be done properly. So even these groups that don't have much training in wound care or in surgical debridement, they do know how to measure the wounds. At least they should.
Yeah,
And
we're hoping.
so we were hoping. So when there's a CMS review or an audit, they all look at that, at the measurements. And um, if you have trouble, if you don't know how to measure or you have trouble measuring, it's probably easier to just talk to the group or to the wound provider and see what their measurements are, discuss those measurements with them, and make sure those are the same and they fit each other. Because if they're different, then um,
It probably calls the whole thing into
it raises a lot of
question.
questions.
Yeah.
Yeah, it raises a lot of questions and also raises a lot of questions about your agency's qualifications to do wound care because uh, obviously a wound group or a wound physician, they should know how to do it and they
Right.
have a lot of training in that. But if your measurements are different, then it raises a question about your agency's qualifications to measure the wounds or to do wound care to begin with.